if we're thinking of practical steps people can take, so what should people's like mouth hygiene protocol look like?
Oh, this is my favorite question. Thank you for this. My first thing is I'm going to include a body and a mouth protocol. And I'm going to start with the night one first, because that's the most important because we want regeneration during the time that we're sleeping. So first of all, always shower, pick your boogers, let's get them out. Let's floss first, brush your teeth, scrape your tongue. Put some coconut oil on your gums. Just rub it around the gums because coconut oil is bactericidal, fungicidal, virucidal. So we really like that. And we really like for it to hydrate the mouth so that when you're sleeping at night, it stays hydrated and that environment stays hydrated so you don't have any of the bad bugs overgrow. And then you can always vertically tape your mouth so that way you can get good nose breathing and that nitric oxide activation. So that is my nightly routine. In the morning, you floss first, brush your teeth, scrape your tongue, and you're good to go.
Okay, so you like tongue scraping that.
Absolutely. So tongue scraping is important for several reasons. One is that there's so much bacteria that overgrows, and also when we eat food, a lot of the sulfites get stuck on the tongue, and so when we scrape them away, we scrape away the dead cells because our mouth does regenerate pretty quickly. We're scraping away dead cells, we're scraping away bad bacteria. It gives us fresh breath and it makes us feel cleaner for longer. That is the reason why I am a big fan of tongue scraping.
Okay, in terms of flossing, like water picks or ordinary flossing, does it make a difference?
Ideally, flossing is the best. However, if you're not a great flosser, it's better to water pick because you're going to get a better benefit. And my little secret with a water pick is you can take like a little bit of peroxide in 8 ounces of water and put that in your water pick and use that to clean in between your teeth because peroxide is extra oxygen. And remember, we talked about all those bad bacteria? They're all anaerobic, so they live, if oxygen is present, they'll die off faster.
Right. So you're water picking with a very light hydrogen peroxide solution. Other lifestyle factors that would help your oral health, like diet or sleep. With diet, particularly, I would think.
Yes, diet, but most importantly, the first thing, Richard, I'd have to say is going to be vitamin D. Making sure that we have good vitamin D. Vitamin D is important and an integral part of your teeth and bones. So vitamin D is important for your sleep, it's important for your immune system. So number one is going to be vitamin D3. Second is going to be B12. It is something that a lot of people are deficient in. And also, when you don't have enough D3 and B12, our gut lining is not as tight and our immune system is not as strong as we want it to be because our gut is our immune system. So when we have D3 and B12 in place, we can actually have a healthy gut microbiome as well as a healthy oral microbiome. So those be the number one things that I would say. And then, of course, frequent snacking is an issue. Intermittent fasting is fantastic. I'm a big fan of that. And detoxification is really important. So, getting into the steam room or the sauna twice a week is fantastic for getting our bodies to work really well. So those would be my major things that I would really talk about. Because, when we talk about diet, we all know we're not supposed to eat sugar. I wouldn't be adding anything to the conversation if I said that to you. We know we don't eat carbohydrates. We should be cutting down on those. So, my favorite diet is a keto flex diet. Keto flex means, obviously high protein, high fat, low carbs. And the flex part is really, intermittent fasting, not eating 3 hours before you go to bed so that your body has time to digest the food. It would also have a big impact on your sleep, so that you can regenerate. So things that are maybe not just dental related, but more whole body related is where we want to think here and where we want to go.
You clean your teeth like after breakfast or before breakfast or both?
My preference is before. I like to floss first, brush my teeth because I would like to, my taste of the food, I can taste much better when I have removed a lot of the bacteria from overnight and scraped my tongue. I have a better sense of taste. I feel much better. I can brush my teeth again if I wanted to, or at least at minimum, take some water, swish it around your mouth and make sure all food particles are gone. You can spit that out or swallow it, and it'll work great.
You mentioned supplements. So supplements might be a way to improve oral health. So what supplements would you suggest?
The supplements that I personally suggest that really make a difference with the oral microbiome is going to be a probiotic. The one that I absolutely love is Berkeley Life's prebiotic and probiotic nitric oxide gum. It's fantastic. It hits multiple birds with one stone. We're getting that nitric oxide. We're chewing, we are stimulating the salivary glands, making sure the mouth is hydrated, stimulating the saliva, making the IgG, the pro-inflammatory markers come out. So that is my one of my favorite tool is to be able to use the nitric oxide prebiotic gum is my favorite thing to have. And then the other part that I love is actually a product from ASEA, ASEA. It is a chlorine dioxide. And so what you do with that, you swish, 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 and swallow. The reason I like that is because number one, chlorine dioxide is a great ion for us to have. It also helps the cellular linking of all of our cells so that we can be better protected against any sort of bacteria or viruses. It actually works really well in the mouth and it actually works really well in our intestines as well, making sure that our cellular or cells are interlinked very tightly.
If you eat a good diet, would you normally think that your oral microbiome would be okay? I mean, does it generally look after itself?
No, it doesn't, because one of the things that happens is that you can eat healthy, which is fantastic, but because we're living long now, we're living beyond 60. We're starting to develop that sleep apnea that comes around in the 60s and 70s, right? The dry mouth starts coming around in the 60s and 70s. Um, just by eating healthy is not going to solve the problem. We have to start adding nutraceuticals to be able to help us deal with the oral microbiome much better, which is what I mentioned earlier with the nitric oxide gum. More frequent cleanings, mouth taping, coconut oil on the gums. All of those things are all adjuncts that help us keep our microbiome healthy.
How would how would someone uh, monitor their oral health? I mean, is there any way to do it? We've talked a number of ways, right? We talked about the saliva tests, but is there? How would you do it more? I guess more lightly.
Well, the easiest one I always like to say is put your hand in front of your mouth and blow out and then see if that smells or not. Because if you have sulfur containing bacteria, we know there's a little bit of an issue. The second thing you will also see is that when you floss and you brush your teeth, is there blood coming out in the sink? That's going to tell you there's a major concern happening, right? Those are some basic things to start with. And then if there is a concern, we can do the salivary testing and go down that path.